All my life I've been real, in search of that deal. All my life I've been nice, wish you knew how this feel. Roll up, first thing, don't call me while I'm working. Yeah, I got me some hard bars and a hard hook with that verse in. That thing hitting so perfect, rewind, reverse it. Me, I'm riding that wave, kinda feel like I'm surfing. I'm on my way to that money, pocket full of that cake.
Hey guys, it's Jess
and Jay. Welcome to our channel.
So today we're going to be talking about something that one of our subscribers actually, well, I don't know if she subscribed, but she did request it. Brenda Nuncio, I think that's how you say her name. She said, "Hi, I'm not very aware of med school in the DR. Could you make a video explaining differences between things like board exams, residency, etc. Also, will you be able to practice in the US?" So, this video's for you.
One difference between med school here in the Dominican Republic and the US is the time. In the United States, you have to do 4 years of college, undergrad, and then 4 years of med school, excuse me. Here, you just kind of combine the two. So we do a year and a half of what you consider university courses where we do pre-med. The only major you can do here is pre-med, and then you go into med school, which will be 4 years. So in total, you do about 5 years and 4 months. It's an accelerated program, so that's something to definitely keep in mind.
The next thing would be the culture. In our case, we came to DR. Obviously, I feel like everybody knows that by now. And luckily, we both come from Dominican families. Her parents were actually born here. My grandparents are from here. So to us, it wasn't that big of a culture shock, but there were a lot of things that we had to get used to. The way things are done here, how people treat each other, the way you say hi to someone, just formalities and stuff like that. Even the language, like my first language wasn't Spanish, it was English, but I did know Spanish. It's gotten way better. But I think culture is something you also have to take into consideration. The food, the customs, the holidays. Just take that into mind when if you decide to go out of the States to study.
I agree with her. So 3 would be, let's see, oh, you live in Paradise. Well, that's pretty awesome. So you have a beach, maybe it's 30 minutes away depending on where you live, maybe it's an hour away. So if you want to de-stress for a weekend, you just finish an exam, go to the beach. If you want to go to a resort, you can do that too. It's usually sunny here and really hot, and all that's amazing, but you need to take it in moderation, okay? If you have to study or if you have something pressing to do, don't blow it off to go drink and dance because it's Paradise. No, you're here for a reason. Yeah. Remember that reason and make that your #1 priority, okay?
I think that's something that we witnessed that with people that we went to school with. The next thing would be hands-on experience. The amazing thing that I think we both have taken advantage of is the fact that we have already put hands on patients. We've helped with procedures, we've seen a lot of procedures, and we're only going to see more. And we also have more leeway to just say, hey, I want to learn how to do this, and they'll put you to do it. With someone there, walking you through it and stuff, you just have to verbally say, hey, look, I want to learn how to do this, and you'll automatically get priority to do it if you really wanted to, and if the doctor was willing to actually show you, which usually they are.
Yeah.
So I think that's something that we still in this process are going to try to take advantage of and not be so scared.
Yeah.
Me, because I'm terrified of doing things, but that does help us in the long run. So
yeah, absolutely. We get left alone with patients, not to just do major procedures, nothing like that, but it's our responsibility to take the clinical history, to take the vitals. Yesterday, in fact, we were in the emergency room and we were doing CPR on a patient, trying to revive them. So you definitely get a lot of hands-on experience here, and it's a blessing, and you should definitely take advantage of it. Don't be scared. I can't see you. No, I'm just kidding. I get scared too. It's nerve-wracking. It's a patient. You care about them. It's not a little mannequin. It's not a dummy that you get to practice on.
Yeah.
No. This is a real life. Yes, you get hands-on experience. You need to take it seriously. That's somebody's life. They're not a toy. Get it together.
Okay, so what she said. Next up would be price. I feel like this is something that everyone and their mama asks every time we go back home, or when they find out that we're studying here. They're like, oh, isn't it cheaper? Yes, it is cheaper. I would say a few grand cheaper. But there are a lot of things that you also have to take into consideration, which is something that she said at the time. The curriculum is much more accelerated.
Yes.
You don't get as many time off or as many breaks from school. And if we do get breaks, it's much shorter. You know what I mean? So I think you just have to do your homework, look into the school. Pricing's different anywhere you study. Even if you're in the States, if you go out of the States, just make sure that you get a rundown. Call the financial aid office. And that's what I had to do in my case. And just do your homework. I think that's the best thing I can say. But there is a price difference. You just have to look it up.
There you go. And I would also say we work on a trimester system. So like she mentioned, we have shorter breaks, and it's because most of our time is spent in school. If you are okay with being away from your family for 90% of the year, then come through. But yeah, we work in a trimester system, so don't think that you're gonna have 2 months of vacation. Like that's never happened. The most we've had is 3 weeks.
Yeah, and that's literally only in December that you can kind of get 3 weeks off. And that also depends on finals week. You have your finals Monday through Friday, the last week of class, which is like week 16. And depending on what day your last final lands on, which it could be a Monday. If your last final lands on a Monday, bro, you have an extra like 5 days off. Almost a whole week off.
Yeah.
So it just, again, it kind of depends. But our longest break is in December, and in between we're off in April and we're off in August, and we're only off for 2 weeks. Again, like she said, if you're willing to make that sacrifice, which is not easy, it's very hard. Again, like she said, we fall off the wagon emotionally, where we like get super homesick and we break down and we call our moms and stuff like that. Shout out to you, mom.
We love you, mom.
But it's a sacrifice, so if you're willing to do that to get it done quicker, go for it. You can do it. If we can do it, you can do it. I come from a big family. She comes from a tightly knit family as well, so it's hard, but it is doable. That's again something that you really have to make sure that you're okay with, because you will miss out on birthdays, holidays. Like, your family gets together on Sundays, your barbecues, you ain't gonna be there. Like, you know what I mean? It's hard, but just sacrifice.
Oh, grading is very different here.
You don't want to know.
Okay,
but
so
you gotta
I'm
know.
about to tell you.
Yeah.
So we work with 100 points, normal, right? Okay, the 100 points you get, basically you're trying to save that, because if you take an exam, let's say the exam is 15 points, and you get a 7 out of 15, let's hope you don't, but if you did, 15 minus 7 is 8. Okay, those 8 points that you lost are now subtracted from your 100 points. You get me? So you're constantly deducting, constantly losing points. If you're, losing points on exams, assignments, attendance, whatever, that's coming away from your 100. So when you get an A, you really are happy with your A because you worked hard, okay?
Like, in my case, I'm just like, I just want to pass.
Yeah.
Not
A gang. So yeah, no. But yeah, you really have to work hard. I mean, I feel like we've said that 50,000 times, but this isn't an easy path. And if you want it, you gotta work for it. And will you cry? Probably. Will you want to go home? Yes. You know how many times I said I was gonna quit? But I'm still here.
Same.
She helped me a lot. I really appreciate her, and my family and my friends, constant words of encouragement. It means a lot. It really does, because sometimes you don't want to hear it, but you need to hear it. And me, I'm a ball of positivity. So when I'm like not positive, it's bad. I'm what's it called? A warp? No, like a fortress of darkness when I'm not positive. So anyway.
A fortress of darkness, that just registered. A fortress of darkness. Wow.
Yeah, I get dark and twisty words, Meredith Grey. So. Yeah.
Okay, the next thing, which we kind of touched on, is distance.
Yeah.
You're gonna have difficult days. Like she said, you're gonna have days where you're like, bruh, I can't do this. I'm not smart enough. There's no way, financially, emotionally, spiritually, any type of way that I can do this, but you can. Distance does not make that process any easier. Being away from like she said, your family, your parents, your siblings, your best friends, where you grew up or what you're used to, it's a sacrifice. I've said that before. But you just have to make sure that you're willing to make that sacrifice. You're willing to say, okay, from this time to this time, I'm going to just focus on my goal and just set aside things that I want for something that's gonna help me in the long run and pay off. Not today, not tomorrow, not next year, or the year after that, but it will pay off one day. So we're still waiting on that day.
Exactly.
But it'll get here.
It will. And what you said about the distance, I feel like I got the best of both worlds because I went to school for a year in the States. I did my freshman year there and then transferred here. I saw the difference in distance. For example, if I was homesick from school, I could just take a bus ride home and I could see my mom and I could see my dad and stuff. No, here, if I'm homesick, I need to find the money to take a plane ride home, and that's not feasible. So, you know what I'm saying? Like, of course, on vacations, my family will help me out and get me a ticket. But if I'm homesick on a random weekend, I'm just gonna have to boo-hoo it out by myself and figure it out because I'm not going. Who's paying for that? So you need to, you know, think about it. But you can do it if you want to come to school in the Caribbean. Do your research. There's a lot of schools in other Caribbean countries. We just happen to be in the Dominican Republic, so we can only speak about the Dominican Republic. Yeah.
Also, something that Brenda did mention, she asked about residency and she asked about board exams, I think. Our school is affiliated with the U.S., so they accept our diploma from here. And because we were both studying here as an American starting out, we have the advantage that with our diploma after we graduate, they do accept it over there, but we still have to take the U.S. medical boards. We still have to take step 1, step 2, CS, CK, and step 3. And just do the same things that the Americans do. It is a little harder for us to get into the residency from what I've heard from my school, but some people who have matched have told me that just do your work, do the best that you can so you can, you know, shine out. Either way, medicine, getting into residency programs and stuff, it's competition, you know what I mean? So do the most that you can to stand out. Work in your lane, you know what works for you. Find your inspirations, do volunteer work. Do everything that you possibly can to just make yourself stand out. Do you know what I mean? You gotta kind of sell yourself. So I feel like that's anywhere you go to school, you have to do that. So like that's basically towards the boards exams, not towards residency. Same thing applies. You have to do good on your step, study, just do the same things. And if you want to match in a specific residency program, you know that depending on the score you get on the step coincides with certain specialties. So just do your homework, look it up, look at what is the minimum. Also, if you want a specific hospital or a specific state or a specific program, make sure you research that as well, because each program requires a specific step score for that program, if you get what I'm saying. So just do your homework.
Yes, absolutely. And another thing I wanted to mention, because a lot of people ask me this, is are your classes in Spanish? Well, for us, pre-med and about half of medical school was actually in English. And you have the choice of deciding if you want to be in the Spanish section when you first enroll, meaning your classes are all in Spanish, or in the English section, in which our classes from the first semester to about the 10th. That's when all of our classes were in English. Once we got to pre-internship, third year exactly, we were getting, you know, more into the hospitals here and having to talk to the patients and stuff. Everything is in Spanish, and I honestly didn't know that. My parents didn't know that, and that's something we should have asked about, because when I got to the 11th and they were like, everything is in Spanish, I was like, well, luckily I could speak Spanish, but I'm not used to thinking in Spanish, you know what I'm saying? So like all my files in my noggin are in English, so when I get asked a question in Spanish, I have to like translate and figure it out. But yeah, that's just something to be aware of. I mean, it makes sense. When you go to the hospitals here, what is the language they speak? Spanish. So you need to know medical things in Spanish. So yeah, there's that.
And again, shout out to Brenda for actually requesting your, like, I think our first request,
yes,
if I'm not mistaken.
We appreciate you.
We hope that you enjoyed the video. It's helpful. If you have any more questions, you can just comment, or you can write to us through Instagram. We have our Instagrams down below, our Twitters. We're open to helping you guys out. If you have any questions, concerns, if you need a little guidance, or we'll try to help you as much as we can. So any other requests, just leave them down below, and we'll try to do them. Our schedule's a little crazy. We're literally in between. We had hospitals this morning, we have class tonight, so we're kind of just like finessing. But hopefully we can get this video up to you guys as soon as we can. And
yeah, so thank you so much for watching, and shout out to all our new subscribers. We see you,
we love
and we appreciate you. So thank you.
Heart. Look, it's a heart. See it?
So yeah, we appreciate you guys' comments, and I hope you enjoyed this video, and yeah, see you in the next one.
See you, and don't forget to hit that notification bell. I don't know where it is. It's somewhere, but it's a little notification bell. Just make sure you click it so that every time we upload, you get the notification. Because I feel like we haven't been mentioning that, but
yeah, it's true. Turn it on, and you've been here this long, so you might as well subscribe, like, comment, all that. Yay!
Peace.